Welcome to the lecture on hypokinetic diseases. We're also going to talk a little bit about some benefits of physical activity to start with, since that kind of leads into some of the hypokinetic diseases if you are not physically active. And then we're going to talk a little bit about some benefits of posture at the end. Yeah. So, brief little history of death. So prior to the 1900s, most people died of pneumonia. They were also killed off by things like bacteria and viruses. But you can see over the years that that starts to decrease as we find vaccines to cure some of these common illnesses that we have. So the percentages of deaths were really high: pneumonia, influenza, tuberculosis, diarrhea. And then some of these other ones come into play later that we start seeing nowadays. Today's cause of death, though, the number one is heart disease, followed by stroke, and then the number third one is, followed by cancer, and the number three is stroke. We call these hypokinetic conditions or hypokinetic diseases because they are due in part to lack of physical activity. So individuals who choose not to be physically active cost our nation $150 billion each year, and 250,000 people die prematurely because they are inactive. Being sedentary or inactive is really bad for your health, really bad for the bottom dollar, if we're talking to that in terms of US dollars. And it has devastating effects, and it's so easy. So, how do we prevent it? By being physically active. And so sometimes teenagers, and that's why I bring this up, believe that those kind of numbers and statistics don't apply to you. As teenagers, you often feel like you're invincible and nothing can get in your way. I was there. I felt the same way as you, but being a teenager also is a good time to be educated about the benefits of physical activity so you can carry those into your life. So awesome video here, 23 and a half hours. We're going to spend a minute to watch this.
Hi, I'm Dr. Mike Evans, and I'm presenting this visual lecture called 23 and a half hours in partnership with 24-Hour Fitness. It's great to be working with people who have a passion for helping others achieve their individual fitness goals and promoting positive change in their lives. So I have a big interest in preventive medicine, which can mean a lot of things from, cancer screening to eating more fiber to having a good social network. And I mean that in the old sense of the word, but weighing less, drinking less, smoking less, controlling your blood pressure, cholesterol, and so on and so forth. So all these things are incredibly important, and I wouldn't want you to minimize your efforts in any one category, but I want to know what comes first. What has the biggest impact? What has the biggest return on investment? What makes the biggest difference to your health? So I did my research, and I found an answer, at least for me, and it's tricky because, all these things are sort of overlapping. But I picked out this intervention, and because of its breadth, it worked for so many different health problems, and that's what I found so cool about it. So just to kind of walk you through a quick list. So this intervention in patients with knee arthritis who receive 1 hour of treatment 3 times a week reduced their rates of pain and disability by 47%. In older patients, it reduced progression to dementia and Alzheimer's by around 50%. For patients at high risk of diabetes and coupled with other lifestyle interventions, it reduced progression to frank diabetes by 58%. Following over 10,000 Harvard alumni for over 12 years, those that had the intervention had a 23% lower risk of death than those who didn't get the treatment. It's the number one treatment of fatigue. And of course, the kind of outcome of choice there, my favorite outcome is quality of life, which is really all of the above and really about making your life better. And this treatment has been shown over and over again to improve quality of life. So the question is, what's the medicine and what is 23 and a half hours? So the medicine was exercise, mostly walking, so not triathlons. And let me just put it a different way. I think what I'm asking you to do is, if you think about your typical day, so there's 24 hours, and so you might spend most of your day, this varies obviously, but couch surfing, sitting at work, obviously sleeping. And what the evidence that I'm going to show you kind of tells me is the best thing you can do for your health is to spend half an hour being active, maybe an hour. And that if you can do that, you can realize all the benefits I described in the previous slides. So if exercise is a medicine, what's a dose? So when I think of dose, I think of how long, how often, and how intense. I'm going to give you a slightly mixed message, but essentially more activity is better. But I must say the rate of return seems to decline after 20 or 30 minutes a day. So if you're being active less than 150 minutes a week, or more if you're a kid, an hour a day if you're a kid, my flag goes up in the clinic. So my personal take on this is that the literature draws a very broad brush, and so we see big differences when somebody goes from not doing anything to doing something, and after that, the return is more granular. So if we took the Nurses' Health Study, women who went from zero activity to just 1 hour a week reduced their heart disease rates by almost half. So you can break it down, so it can be 10 minutes, 10 minutes, 10 minutes if you want to do 30 minutes of exercise, so it can be broken into 3. If you're only going to do it if it's pre-booked with friends, I have couples that take a half-hour walk every morning or evening to organize their life. A dog is a great walking coach. The data is showing 67% of dog walkers achieve the 150 minutes a week just with the dog walking. And finally, of course, your commute, getting off stop early, taking the stairs, and so on and so forth. The next way to think about it is the reverse. So what I call sitting disease. We know that being sedentary is bad for your health, but a researcher named Leonard Veerman wanted to quantify this, and he did so down in Australia in a big study they did there. They found, compared with persons who watch no TV, those that spend a lifetime average of 6 hours a day watching TV can expect to live about 5 years left. I mean, that's incredible. But then I think, who watches 6 hours a day of TV? And it turns out the average adult in the USA spends about 5 hours a day watching TV or screens. So I find this fascinating that we never think of the TV as something that's bad for our health, but clearly it's as powerful as many other risk factors for chronic disease. So I'm going to finish by asking you a question. And this may have some personal challenges for you. So, you might be very busy with work or kids or both, and you may be in pain or have other priorities. But my question to you is, can you limit your sitting and sleeping to just 23 and a half hours a day? So whether it's hitting the gym and attaining fitness goals or walking the dog or taking the stairs, get out there and be active.
Get out there and be active is what the main point of that is. Love having that visual representation to kind of lay it all out there, that really 30 minutes a day. Little kids, they want you to do more upwards an hour. So as teenagers, kind of try and find a balance between 30 minutes and an hour of day. So we're going to start with our first hypokinetic disease, and that's cardiovascular disease. Leading cause of the death since the 1920s, and it contributes 60% of the deaths in our whole entire country. So about 1 in 4 Americans have some type of form of cardiovascular disease. It's a huge deal. And you guys probably, if you think about your family, friends of family, there's somebody that's probably affected by cardiovascular disease. So we're going to break that down into a couple different types. Coronary artery disease. So that is the number 1 cause of early death. That's when your arteries become clogged. So you think of your arteries. So right here, this very first one here, our arteries are like pipes. Okay. If you don't clean your pipes out, they tend to get clogged with stuff. And so we call that atherosclerosis. So normal blood flows, you can see the channels are nice and clear. As you start getting this plaque buildup or this atherosclerosis, you're going to see it narrows those arteries. And so it's going to make it a little bit more difficult. Down here is an extreme case of it, where there's really not a lot of space for that blood to go through. And what ends up happening is, if you remember from maybe chemistry class, if you decrease that area, you're going to increase the amount of pressure going through. So now your heart has to work really hard to push that same amount of blood that it wants to move throughout your body. So having all of that buildup there is really detrimental. So what's going to end up happening is you can suffer a heart attack or a stroke. So big difference between these two. You'll probably see a test question on it. And this is kind of a life concept that you should know. A heart attack occurs in the heart, where a stroke occurs in the brain. And so basically what ends up happening is that artery is clogged. And so you cut off the amount of blood to that given area. So severely cut off, we would say. Stroke, which is the third cause of death, that's when that occurs in the brain. And so people who suffer strokes, if you've got a spot in the brain here that loses blood supply, those tissues are going to start dying. And that's when you see people that struggle with walking and talking, movement, balance, all those kinds of things. So those tissues have died off, which is really detrimental to long-term health. Cancer is another hypokinetic disease. So we know that there's 100 different types. Cancer, if you had biology class, is basically uncontrolled cell growth. And you can see it here. Normal cell, excuse me, normal cells have checks and balances. We stop a cell, check to make sure it looks good. If it looks great, we send it off to do what it needs to do. But what happens in cancer is we don't stop those cells. We don't recognize that there's something wrong with them, and they'll continue to grow. So second leading cause of deaths, we know that when it's caught early, most people through the treatment of surgery, radiation, chemotherapy, all of those, and medication could potentially stop cancer and make people survive. So getting regular checkups with your doctor to see if you are at high risk for cancer or checking for cancer in certain areas of your body is extremely important. Physical activity. So that's the reason why we have these hypokinetic diseases. So there's a direct correlation between physical activity and cancer. They're not quite sure what it is, but there has been an increased or decreased risk of cancer. So if you're physically active, you tend to have a reduced risk of breast cancer, colorectal cancer, and endometrial cancer. But if you are sedentary and you're spending more time sitting, you're more prone to esophageal, pancreatic, endometrial, colorectal, kidney, and gallbladder cancer. So keeping that body moving. Diabetes. Diabetes is our third hypokinetic disease. So basically what ends up happening in diabetes is your pancreas no longer is able to respond to your blood sugar levels. So two types of diabetes. There's type 1, which is considered juvenile onset diabetes, and type 2, which is usually later on in life. So typically with diabetes, they have a really high blood sugar level. And over time, that high blood sugar level can cause some huge problems within your body. It will cause all these types of issues that you have up here, of these complications. You get people that will actually lose limbs from it. They'll have issues with eyesight. They're going to lead to osteoarthritis, heart disease. Some of them have extreme fatigue, dizziness. How do we prevent it? Physical activity is one big way. So the two different types, I said type 1 was juvenile onset diabetes. That one is not a hypokinetic disease. So oftentimes that is a genetic case where individuals are born with it, and it only affects about 10% of all diabetics. And so if type 1, they're going to take insulin because their body is not actually producing insulin anymore. With type 2 diabetes, which is a hypokinetic disease, basically what ends up happening is your body has destroyed all of its little sensors or receptors for insulin. So even though your body might be able to produce it, it's not able to recognize it. And so those individuals do things, check their blood sugar levels, take insulin, check their diet and what they're eating, all that kind of stuff. Obesity. So we know when someone is obese, typically it's a result of inactivity. In 1980, the incidence of obesity among teenagers has increased from 5% to 14%, which is a 300% increase. That number is even higher today. Osteoporosis is a result of hypokinetic disease or inactivity. So you can see at a healthy bone, we have that spongy inner portion of a bone. When you have osteoporosis, basically what ends up happening is you have bigger holes in the bones. And so the bone itself tends to become a little bit weaker. Oftentimes people think this is something that only happens in older adults, but we'll see on our next slide here that osteoporosis can actually start beginning in your 20s. So, ways to create healthy bones, not only having a healthy diet, but having a regular exercise regime, because having that pounding on your bones, so whether you're running, you're jumping, you're walking, any of their weight lifting, any of those weight bearing activities are going to put more stress and pressure on that bone. That stress is going to cause the bone to want to lay more bone layer down. Whereas if you're inactive, you're going to see that those layers start thinning out and lead to osteoporosis. So you can see here's my osteoporosis threshold, meaning if I'm above it, I do not have osteoporosis. If I'm below it, I'm at risk for osteoporosis. And then here's a fracture threshold, meaning you've heard of older adults, especially ones that might be in assisted livings, or older adults are at home. All they did is slip and fall and then they broke a hip. Really easy for older adults who are prone to osteoporosis to break. So you can see children, everyone kind of starts out at the same level. But individuals who are active, you can see through your teens and young adults, your bone density increases. As we get into young adulthood, I said, the amount of bone density starts to decrease. That's just a natural part of aging. But if you still maintain physical activity and a healthy diet, you can see you're still above that osteoporosis threshold, even though you might be an older adult. If you are sedentary and inactive, you can still maintain it for a while. But as you get older, you'll start passing through that osteoporosis threshold and then entering that fracture threshold. So, other hypokinetic conditions that we'll bring up here. Physical activity is going to help boost our immune system. We call this process cellular house cleaning. It's something that you can research, which is pretty interesting. Our body wants to be as efficient as possible. So it's going to do whatever it can to make sure that the body runs smoothly. And so what it will do, if you are exercising regularly, that's considered stress on the body, but it's good stress. Your body is going to make sure that your cells are really in tip-top shape. So they're not going to have a lot of those organelles hanging around that they don't necessarily need. They'll get rid of them as soon as they can. And so it makes them more efficient, so the more resistant of fighting colds and flus and that kind of stuff. So during this time of COVID-19, that might be an opportunity for you guys to motivate you to get outside and move. Even moderate physical activity has shown to reduce some forms of arthritis because you're keeping those joints moving. You're hydrating yourself, and so those joints are more lubricated. And so that risk of those joints rubbing against one another is decreased. And then when we've talked about all the time, being active helps you guys mentally. So decreased risk of depression. And a third of adults report that they feel depressed. So adding physical activity is going to reduce that rate of depression. So on the flip side, so hypokinetic conditions were the result of inactivity or a sedentary lifestyle. We can flip the other way. And we've got what are called hyperkinetic conditions. So hyperkinetic conditions mean that you have too much physical activity in your life. And what this can lead to is it can lead to overuse injuries. You keep on pushing yourself. And if you are an athlete, maybe you've experienced an overuse injury before. It can lead to activity neurosis, meaning that somebody is so obsessed with exercising that they get really upset if they miss a regular workout. And often what they'll do is they'll work out when they're sick or they're injured, which further compromises their immune system, which further leads to overuse injury. Another hyperkinetic condition would be a body image disorder where people feel like they need to get their body to look a certain way. Oftentimes, this might be based on social media, what we see out in the public with celebrities, athletes, and we want to make our bodies look like it. But what oftentimes we don't know is that our bodies have a set metabolism, a set size that it's going to be at. And if you try and go lower at it, it's going to just, like I said before, with a nutrition unit, it's going to mess with your metabolism. Teenage boys, on the other hand, they tend to be really excessive about putting on weight, getting bulked up, getting bigger, especially in the teenage years. They might lead to taking steroids or other supplements to bulk up their bodies, which, boys tend to develop later than girls. And so maybe the teenage years, they're not at that point physically, where they can get to that point, but that can be an overuse right there as well. And teenage girls strive for extreme thinness. So that's the other side of the scales, the hyperkinetic conditions. And hyperkinetic condition can lead to eating disorders. So eating disorders affect both men and women. It does not discriminate. It obviously affects women more than men, but restricting those calories, which can definitely lead to increased weight in the long term, and is really, really high stress on the body. So I do not recommend it. All right, so that is it for the hypokinetic and hyperkinetic conditions. I wanted to throw in this last portion because I think it ties in really well to physical activity. That's having a healthy back and good posture. I'm sure we have somebody directly related to us, or you yourself might be suffering from some type of back pain, back issues, that kind of stuff. So 25 million Americans each year seek a doctor's care for a backache. And they do so as much as a common cold. It's the one thing that people complain about the most. And 80% of adults at some point in their lives experience back pain. And it's horrible. It's miserable. If you think about your back, that's what's going to generate all of our movements in our body. So having any type of pain in our back really disrupts our quality of life. So, back problems are a result of poor muscular strength, endurance, and flexibility. So, maybe you do not have a good, strong core. Maybe you've got hip flexors that are really tight, hamstrings that are really tight, your low back is really weak. All of those can lead to back problems, in addition to poor posture. Okay. And maybe all of you guys are adjusting yourself right now, making sure that you're sitting upright where you're at. Improper lifting and work habits. So, not bending at your knees or squatting down, not embracing your core. All of those lifting or lifting and twisting at the same time can injure your back. Some people are more prone genetically to have poor back problems. Others might have been born with scoliosis or have arthritis. So, all of those can lead to back problems. So let's talk, this is our last slide, quickly about posture. I myself has suffered from poor posture almost my whole entire life, and it has led to a lot of back issues. And I've spent a lot of time in therapy trying to navigate getting myself back on track with posture. So if we're talking about sitting posture, we tend to slouch a lot. Okay. So rounding of our back, having our neck jutted forward. Or some people do the opposite, where they actually dip into their lower back and bring their shoulders back too far. And you can see the head tipping backwards there. Put strain on the front side of the body, put strain on the lower side of the body. So when you sit, having your feet flat on the floor, making sure your shoulders are down and back, and that your eye level to whatever you're looking at is facing forward, not tipping down or tipping back. Standing postures. Now, obviously, these are way more exaggerated than you would see in real life, but take a minute when you're out and about and look at people and how their posture is. Stand and look at your family members. Look at yourself in the mirror. So you'll get what's called a sway back. So this lower back area comes in. This one's called lumbar lordosis because this is your lumbar back, where you've got that bowing of that lower back and the chest is out. This is thoracic kyphosis. So that's when the shoulders round forward. And so now you've got shortening of the pec muscles, and then you've got stretching of the upper back muscles. Forward head, where you've got the head and neck is facing forward. This one and this one will eventually lead to that kind of hump back that you might see older adults have because they've spent majority of their life walking around in this posture and they haven't had it corrected. But you can see good posture. Look at the alignment. The ear is over the shoulder is over the hips are over the heels. So making sure you're in straight, proper alignment if you were to draw a line straight down. And that's what you see here as well. The ear is over the shoulder is over the hip, in that straight alignment. One last thing I want to point out, I love this visual representation because we are a very tech heavy society. And I see you guys doing this in the hallways every single day, walking with your heads in your phones. And so imagine your head and neck is forward. Okay, so we know our head weighs whatever amount of pounds, right? So if you're at normal posture, ear over shoulder, shoulder over hip, la la la, you have a normal 10 to 12 pounds, depending on how big your head is, of weight in that area. Okay. Now imagine if you're looking down at your phone at 15 degrees, you have now increased that load to 27 pounds. If you have a 30-degree bend, 40 pounds, 45 degrees, 45, 49 pounds, and 60 degrees, you have 60 pounds of weight. And I know you've all been here looking into your phone, and then you stand up and you're like, oh, you have all this pain in this upper back here. So next time you are on your phone, don't sit in this posture for a long period of time. Don't sit in any of these postures for a long period of time. Maybe you need to take some time to get up and move around, and stretch your body out so that you don't exhibit back problems in the future. Okay. So how do we maintain it? If you go for long periods of time and you don't correct them, it's going to take that long to get back into good posture. So if you had just a quick injury because you picked something up and twisted wrong, you might recover from that quickly. But if you've been standing with poor posture for 10 years, it might take you a year or two to get back into that good posture. So always being aware what that correct posture is. And with good practice, you can get there. So always walk tall and proud with your chest up. Practicing yoga is going to stretch out all of those body parts. Avoiding crossing your legs while you're sitting. Swimming is going to take a lot of stress and load off your body, and sleeping on your back is actually the best. I know some of you guys are stomach sleepers or side sleepers, but sleeping on your back has been proven to be the best posture to sleep in. So that is a little bit about hypokinetic diseases, and thank you guys for your time.